Alright, to start my acid-base imbalance series, we're going to go ahead and talk about how you can do the math side of it to figure out what the imbalance is. When I say imbalance, there's respiratory and metabolic, and then there's acidic or alkaline. So we're going to talk about the math problem. Later in this playlist, you'll be seeing each of those four imbalances in its own video, so we can talk about why you'd see a patient in this imbalance and what you're going to do to correct it. So to start, there's three values you want to look at in the problem: the pH, the carbon dioxide, and the bicarbonate, also known as HCO3. So they may give you other things in the problem, such as patient's oxygen saturations or a little bit of history, but if you got these three, that's all you need to figure out which imbalance it is. So let's look at the pH. Here you got acidic and bases. So you want to do is pH is arranged between 7.35 and 7.45. With carbon dioxide, a range of 45 to 35, and bicarbonate, a range of 22 to 26. And so what you want to do is go ahead and just write this on your test. 6 dots, and then write these values down. And then that way you'll know, you can just look at it, and I'll show you how we're going to use this. So, why is this acidic? 7.35, the lower end, think bottom, and your bottom is an acid, it's acidic. Okay? Carbon dioxide, you see it's switched here. Think carbon dioxide, carbon diacid. So, high amounts of carbon dioxide are acidic. And when it comes to bicarbonate, just know bicarbonate, basic, is something that is going to add base or alkalinity to the blood. And it's from 22 to 26. So once you have this drawn out, we'll go ahead and talk about these problems, okay? So let's do an example. Here we have a pH of 7.3, so we already know it's acidic. Carbon dioxide of 50, and HCO3 of 28. So what matches? We got one dot here, and then we got these two. These match. So for this problem, it's going to be acidic due to carbon dioxide. So that would be respiratory acidosis, because they are matching. Alright, for our next problem, we've got pH of 7.5, CO2 of 30, and HCO3 of 24. You can see these two match. So this is alkalosis, and it's respiratory because it's CO2. So this is respiratory alkalosis. For our next one, pH of 7.29. We have a CO2 of 37, which is in the middle here, and HCO3 of 20. So what matches? These two match. And so what you have is acidosis due to bicarbonate. And bicarbonate is made metabolically, so that would be metabolic acidosis. For the next problem, pH of 7.49. You have CO2 of 47. And you have HCO3 of 30. What matches? Metabolic alkalosis. Last one, you have pH of 7.4. You have CO2 of 47. And you have HCO3 of 28. Here you can see that their pH is normal, but you can see that these both are out of the norms. In which case, this is where we're going to bring up compensation versus not compensation. So, in this case, it's fully compensated. What I mean by that is, whichever of these is the cause, we're not talking about that right now, but one of them is off, the other one is correcting itself, the body is responding, and the pH is normal. So it's fully compensated. There's still a problem, but their pH is fully compensated. In these ones where I got alkalosis due to respiratory, if whenever you find that the two are matching, if the other one is on the opposite end of the spectrum, that means it is partially compensated. What that means is it's responding to this being off, but your pH is still off. If it is in the normal levels, and these are still both off, this is saying it's off, but this other one hasn't even tried to compensate. So this tells you the compensation, what the body is doing, how is it responding, and then which is the cause of the acid-base imbalance. So look forward to a video about each of the 4 types of acid-base imbalances.